once again, it is Wednesday night, and where else would you rather be? My name's Kane, and you have come here tonight to do some more KFP practice for the exam. It is coming up pretty closely. How are you all going? I still need to work on that volume. There we go. Now, hopefully, you've all had a nice refreshing break. You've had your Christmas, New Year's, you've gone back to your study, and are now ready to get back into it. We are, of course, 24 days before the exam. We've spoken a lot in recent weeks about making sure you're identifying your weak areas and trying to target in on that. And I thought, what better opportunity than to start to talk about then refining your time management. You've got that chance to find your rough spots. And so as you're tightening that up, I want you to also focus on the time of getting through the exam. There's a couple of tricks here. Things that I wish someone had told me earlier on. And so one of the first things I want to say is use that first 5... Pardon me, can't kick that cough. Use the first 5 minutes to actually plan out what you're going to do. Read through the exam and get a feel for the questions. There's going to be some that are tricky. That's fine. There's going to be some that you look at and say, I am going to smash this. Focus on those. Have a bit of an idea of what order you want to do some of these questions in. And this is where using your scrap paper to jot down question numbers. And what I've found quite useful is to use the side of the page as your kind of rule of thumb. Up the top are the questions that you feel more confident in answering. Have those numbered higher up the page and slowly jot down the numbers according to roughly how confident you're feeling about those questions as you go along. You can then use that as your template to go through the exam to make sure that you're actually doing those easier questions first. This not only builds up your confidence, but also gives you strong momentum in terms of getting through the exam at a good pace. Pardon me. Now, don't be afraid to skip difficult questions till later on. And if you get to a question within a case that you're not confident on, remember to read through the other sections and see if there's any hints or tips or tricks in there. You'll probably also find, again, that other cases might tip your memory and remind you of things you would have otherwise forgotten that you can use in other cases. So feel free to mark that for review and come back to it later on. Now, of course, once you've actually finished the exam, go through and quickly reread your answers carefully, making sure that you're avoiding the usual traps and pitfalls like using abbreviations, providing more than one answer. More than one answer per line, and really getting through that. Remember, you have 4 hours to complete the exam. It is handwritten. Please, please, please tell me you are practicing writing by hand for your practice exams now, because that is the only way to get used to doing this exam and getting through it in the right amount of time. If we break it down, you've got 26 cases, so roughly 3 to 4 questions per case. Let's say you've got 9 minutes per case then. And that means roughly 2 to 3 minutes per question. That's one of the reasons why I try and push to do these questions here tonight in 2-minute blocks. That gives you plenty of time to be able to go back later on, amend things, change things, make sure you're confident with the answers that you've given. Now, if you do find that you're actually running out of time, this is where some of the practice exams, particularly the RACGP practice exams, come into play. Don't panic. Just do your best to provide some answers that you can there and move on. Try and leave a bit of time later on to go back and fill in those gaps if you can, but just get something down on the page. Remember, you only lose marks if you're putting down answers with too much detail. So feel free for those ones you're not too sure, just take a punt, put down something, and as long as it's not, obviously terrible and a kind of a killing answer, so to speak, it's better than leaving it blank. Now, this might seem a bit counterintuitive, but try and take a couple of breaks through the exam as well. Even if it's just a 30-second kind of stretch your arms, focus on something across the other side of the room, not looking at other people's exam papers, of course, but something to just give you that little bit of a rest so that you can keep yourself fresh, keep yourself engaged. Try and have a little move around every hour or so just to clear your head, avoid getting tired. All right. Now, of course, you have come here tonight because we have practice questions, and let's get that started tonight. We'll put 2 minutes on the clock. Case 1, question 1. Your time starts now. All right, time is up, and hopefully you've got some answers in. So this is something that I think a lot of us can have some difficulty with, because for us it seems like a no-brainer to vaccinate. The evidence is overwhelming, but it wasn't something I fully appreciated myself until I became a father. You want to make sure you do the right thing by your kids. And with so much misinformation and half-truths kind of out there, it can be really tricky for people, particularly if they don't have good medical literacy, to realise what's good information, bad information, and make decisions. And so one of the first things we need to do is to remind ourselves that we are from a relatively privileged position, and that we need to focus on that and do what we can to help look after this child as well. So step one really is to try and prepare yourself to spend time with the parent and child. Acknowledge to yourself that this is not something you're probably going to be able to fix in a single consultation. This might need a few return visits with information provided to actually get across that line. Important to explore and address concerns. So actually work out what the worries are, and tied into that as well is not to dismiss those concerns. So really acknowledge them as legitimate concerns from that parent, whether or not there's any kind of factual basis or scientific grounding behind it. As is part of the checklist for all vaccines, you want to discuss the risks of disease and the vaccines as well. And it's one of the few times I think they would accept having an "and" in there. If you want to really play it safe, though, you could space those out over two answers, so discuss the risks of disease and discuss the risks of the vaccine as well. Of course, you want to make sure you have resources to support your discussion, and this is where resources such as the Myths and Realities, this booklet's a little bit old now admittedly, but the facts in there are still perfectly valid, as well as things like the Australian Immunisation Handbook. Now, tied to that as well, try and avoid overwhelming people with too many statistics or facts. So try and break it down into simple bite-sized chunks, and this is where having multiple consultations can really make the difference. Of course, offer the further opportunities to discuss vaccinations. Give them a chance to go out and do their own research. I personally always encourage people to actually go out, do their research, bring back the information they find. We can go through that together and we can work out, is this good information, is this bad information? How does this impact the decision they want to make for their child? All right, hopefully that makes sense. Let's go to question number 2. 2 minutes on the clock and your time starts now. Now, this is a question that I think would leave some people pulling their hair out in frustration if this would happen to them in real life. I actually love this. This is a great opportunity to discuss those facts and to talk through what information and misinformation is out there. So, three key points. The first key point here is that there is no scientific basis to support the use of any homeopathic preparations in preventing diseases. Another way to word that, although you might be getting a little bit too wordy and a bit into overcoding, would be something like homeopathic preparations are manufactured by making successive dilutions to the point where none of the original material is contained in the preparation. This lacks any benefit to preventing the disease. I'd probably stick to the first option though. Now, of course, the second part to this is the fact that it's talking about the safety comparative. And so you would say the use of conventional vaccines is well established through large-scale studies of safety. And for the final point there, the use of conventional vaccines is well established through large-scale studies of efficacy. So we know they work. You probably wouldn't use the word efficacy when talking to a patient, but that would be a perfectly valid answer for the exam. As an aside, and I wanted to point this out, the Australian Homeopathics Association and in the United Kingdom, the Medical Association for Homeopathy does still actually recommend conventional vaccination with standard vaccines. And this is, I think, something that you could mention to parents as well to let them know that, yes, they've done their research there, there's things to go through, but even those organisations supporting homeopathy say you should still vaccinate your children using standard vaccines. Now, of course, we've gone through and wouldn't you know, I think the parents might be willing to give this a go. Nothing could go wrong, surely. Well, let's get 2 minutes on the clock. Your time starts now. Call it Murphy's Law, call it whatever you want. You just know it's these cases where you've had these kinds of chats that things are going to go wrong. This is, of course, a case of anaphylaxis, and the college really does like us knowing the proper management for anaphylaxis. Now, I'll point out here as well, this is asking for management steps. Doses are not required. This means we have access to pharmacological and non-pharmacological options here. Step 1. Call for urgent transport to emergency, and specifying you're calling 000 for urgent, so you're specifying the qualifier there, transport to emergency. Would get you the full marks. Adrenaline, intramuscular, that's where you're going to get the higher marks there. So first round management of anaphylaxis is adrenaline, second round management of anaphylaxis is adrenaline. They really want you to know that. Now, of course, doses are not required, but I always like to throw it up here so that this sits in your mind. Essentially, it's whatever weight they are, just add a decimal point in front of that, really, and if they're over 10 kilo, you're going to get your answer there. So 0.01 mil per kilo of your 1 in 1,000, and this is what most people carry. Of course, if you have a EpiPen or EpiPen Junior, feel free to use that as well. Now, we have mentioned here that they are pale and floppy, so oxygen would be indicated, and as long as you're putting some kind of sensible flow rate, you should be fine. There's a little bit of ambiguity as to whether or not flow rates would constitute dosing, and I would probably risk overcoding and putting something in there as opposed to just saying oxygen by mask. You could add potentially a qualifier to maintain saturations of over 96%. It's whatever you feel more comfortable doing. Pardon me. Now, positioning for a infant or neonate is in the horizontal position, so across the body. And this is per the Australian Commission on Safety and Quality in Healthcare. This is their official recommendation. This is adequate positioning for airway, and as well, I think also gives that parent the reassurance everything's kind of happening as it needs to. Now, if you can, obtain IV access with cannula would also be a sensible thing if this is something you feel confident doing, of course, and as well as treating hypotension with normal saline, 20 ml per kilo as a bolus dose. Again, you wouldn't need to specify dosing there, but if it's something you need to know, this is one of those numbers you should always keep in the back of your head. Now, you would also get a mark here for continuing to monitor vital signs. This is something as well that is an important part of anaphylaxis, to making sure that you're actually getting adequate response, and if need be, can give follow-up dosing. Lots of options there, 5 marks available. This should be easy marks for you, so fingers crossed you've done well. Regardless of anything else, these are all things that I want you to memorise, know like the back of your hand, because you never know when it will save a life. All right, we've got more questions coming up. Let's get 2 minutes on the clock for our next case. Your time starts now. All right, time is up, and here we have an inflammatory arthropathy, and with this kind of story, I'm hoping, and if you haven't already picked it up already, hopefully reading through the investigations kind of hints, you're probably looking at a case of rheumatoid arthritis here. So investigations here would be an FBE, ESR, CRP, rheumatoid factor as well, anti-CCP if it was on this list, but it's not, and plain X-ray imaging of the bilateral hands there. And important to note, this would be bilateral hands given you've got both hands involved. Now, again, this is one of those situations where we're going to have more weighting towards particular things, and so here, what we're really trying to say is, are we certain this is rheumatoid arthritis, and checking your rheumatoid factor would certainly be giving you extra marks there. Likewise, you can get a lot of information out of plain X-ray imaging of those bilateral hands to see if there's anything else happening in those joints that could be contributing to our symptoms. Now, of course, these are your initial investigations. There is arguments as to whether or not you would do a anti-CCP straight away, or if you'd potentially wait for the rheumatoid factor to be there. And so in situations like this, you would probably find that would be either left off this list here, or I think you would probably get enough people in there putting that down as an answer that you'd probably get that mark there as well. But from this list here, these are the ones that make the most sense. All right, next question. Let's get 2 minutes back on the clock, and your time starts now. All right, time is up, and I think it's pretty easy to sometimes forget just how important non-pharmacological management can be for these kinds of conditions. Now, in the case of rheumatoid arthritis in particular, we know that aggressive weight control to get that BMI below 30 can have profound implications in ongoing management. Now, tied into that as well, things like regular exercise, looking after your heart more than anything else, can also be incredibly important. Now, we have specific mention here that this is impacting on her daily tasks due to the hand pain there, and so you would definitely be scoring some marks for referral to an occupational therapist for home modifications. Specifying why you're making that referral is very important, and really it's about then restoring that daily task functionality. So regular exercise, again, using RACGP guidelines, specifying that 30 minutes per day, at least 5 days per week, definitely going to score you. Psychosocial support, this is a chronic debilitating condition that often leaves people becoming increasingly reclusive as their functional capacity declines, and so referral to an appropriate support group, psychologist or online supports would definitely be worthwhile. We know that for rheumatoid arthritis, sleep is often very disrupted, and so sleep promotion can have overall health benefits as well as been shown to improve pain control. You would be wanting to get the cigarettes stopped, definitely, as well as thermotherapy, so hot packs or ice packs. Now, I did mention before about the cardiovascular risk profile being particularly important for rheumatoid arthritis. In fact, if you're doing the CVD risk calculators for anyone with this condition, multiply the value by 1.5 times. That's just how important it is to make sure that you're having these things under control, because inflammatory arthritis and rheumatoid arthritis puts people at significantly increased risk of cardiovascular events. All right, now we've got more questions, so let's get 2 minutes on the clock, and your time starts now. All right, now this is a case of shingles. We've got that classic appearance of that stripe of pus-filled vesicles in that incredibly painful rash. And we're within the appropriate time frame, within 72 hours, to be commencing our antiviral medications. So 3 specific management options. This would be oral valacyclovir or famciclovir in this instance, would get you the 2 marks. That's probably the most important thing to get in this instance. Oral paracetamol for further analgesia, oral ibuprofen for further analgesia, and it's pretty reasonable if there's significant pain, and this has specified, very painful, would be reasonable to also consider things like oral prednisolone, which has been shown to be a significant improvement in pain control, in particular when combined with paracetamol and ibuprofen in the case of shingles. Hopefully you're happy with those answers. Of course, we've got yet more questions, more cases coming up. The show must go on. Let's get 2 minutes on the clock, and your time starts now. Alright, time is up, and that ECG was taken from the Life in the Fast Lane ECG library, which hypothetically may be a common source for the RACGP to source some of their ECGs from practice exams and exams that I've seen at least. Now, of course, what is the most likely diagnosis? If you want to get really into the fine details here, this is an acute, so you're specifying how urgent this is, acute anterolateral ST segment elevation myocardial infarction. If you're specifying the fact that this is a STEMI, you've specified the acute, you've specified location, you're going to get full 3 marks there. Now, if you were to just say this is acute ST segment myocardial infarction, you're going to lose out on some of those marks. Remember, this is a consultant level, fellow level exam. We're trying to show that we can interpret this ECG and know exactly what we're looking at here. If you were to just say ST segment myocardial infarction, yeah, you're going to get a mark, but you're lacking some of that finesse. And remember, we are not using abbreviations. If you were to use just STEMI, you're not going to get marks here. Yes, we all know you know what you're looking at here. You're looking at an AMI, but we want you to know exactly where this is. You want to know what in particular is going on here, and in particular why this is so important to be very, very quick with your management. Could that be an upcoming question? We'll find out. Let's get 2 minutes on the clock, and your time starts now. Alright, time is up, and this is one of those U-turn questions where you think, okay, I know which direction this is going in, and no, they trick you. They do a complete 180 and throw something else at you. And I think you'll see this as well when they want to try and assess as many different domains as possible. So, here we're looking at some of those medical legal issues, and in particular, in this case here, you want to be covering bases. You want to be making sure that you're protected as well as providing that patient with the opportunity to have their concerns addressed. So one of the first things you can put down for here that is definitely going to get you marks is to contact your medical indemnity provider. For extra thoroughness, you could mention in there for advice. You also want to acknowledge the patient concerns. One of the things that comes back from review after review about patient feedback is that often patients just want to have their concerns acknowledged, and so really important to have that in here as well. Now, you would be referring to the practice feedback policy. Hopefully your practice has one of these. It is a part of accreditation to have these in place and is something that you probably should be familiar with yourself no matter what happens, because you're always going to have situations where patients do need to submit feedback to you. This would be something as well that's worth discussing with the practice manager or senior practice staff. And of course, you want to be documenting these events carefully in the patient record as well. All right, one last question for tonight. Let's put 2 minutes up on the clock and your time starts now. Alright, time is up, and sadly this is a situation that you may well find yourself in one day. It's an unfortunate fact that there is a higher rate of things like alcohol and substance abuse in the medical profession, which I think is unsurprising if you consider that we have a high stress kind of work. We deal with things that the general population wouldn't necessarily deal with, and it's possible that it's going to take a toll on our mental health, and I think we have to prepare ourselves to deal with that. Now, in this particular case, what appropriate management steps should you be taking? 3 management steps. Well, the first thing I think you really need to look at here is assess if they've been affected by alcohol at the workplace. So essentially what you're wanting to know is, are you required to actually make that mandatory report to the Australian Health Practitioners Regulation Agency? And yes, you have to spell that out. No more abbreviations, remember? Now, other things you should be doing as well, looking after them. So advise them to talk to their general practitioner. Providing details for drug and alcohol support services, and there is of course the Doctors Health Advisory Service for anonymous help if they want that option as well. Advise them also that you will need to seek guidance from your medical indemnity organisation. Now, it's pretty unlikely, I think, in the actual exam that you'll get these two kinds of questions back to back, but I want you to know that even if you do, having this thing there of, again, this is a slightly new situation, slightly different situation, and I think it's still very reasonable and appropriate to be contacting your indemnity provider. Hopefully not something you have to deal with anytime soon. All right, we have gotten through another Wednesday night. We are counting down. It is almost time for the exam. Hopefully you're getting prepared, you're feeling confident and getting there. Now, of course, I'm going to continue doing these right up to the exam, and I'll do a little celebration after with you as well. So feel free to spread the word and get that message out there for everyone. Of course, we are over the 200 mark, and I'll throw up onto here as well. A very big thank you to all subscribers for really making this happen. Without your support, I wouldn't be doing this each week. So I cannot express my thanks for you enough. Of course, I popped this name up here because I did promise if we do break that barrier, I wanted to celebrate in some way, shape or form. So if you wanted to reach out to me on Twitter, if this is your YouTube username, I've got a couple of resources that might help your study. This is not bribery, not some kind of competition, just my way of kind of paying it forward and saying I want to offer some help and support for those out there. So I'm on Twitter at KaneTreble. Feel free to DM me there. It's pretty easy to work out all my contact details. So reach out in some way, shape or form, and I'll have those on the way to you. Now, of course, that's another week down. Hopefully, you can now go to bed, rest up, recharge. If you want to get a bit more study in, do a few practice questions, why not? I know you're keen. Otherwise, I'll be seeing you again again at 8:30 next Wednesday night, where we'll go through a few more practice questions and a few study tips as well. So till then, take care.